Welcome back. Good Monday morning to you. Taking a live look via our Hilton Bayfront cam. Beautiful downtown San Diego. Good morning to you. This morning we're actually talking about prostate cancer, how common it is, and how our diet can play a role. Joining us this morning is Dr. Richard Chaffoo from Scripps. He's here to explain what we need to eat and what we need to stay away from. So let's first of all talk about how common prostate cancer really is for men.
Erica, prostate cancer is unfortunately the second most common cancer in men. Skin cancer being number one, prostate cancer being number two, and unfortunately it's not something that's diagnosed very early on. So we estimate in the U.S. there's about 3 million people that have prostate cancer and about 200,000 cases a year. Most of the time though, it's a disease you're not going to die from, but unfortunately about 25 to 30,000 men a year do die of prostate cancer, and that's if it's a more aggressive cell type or if it gets outside of the prostate and metastasizes.
Gotcha. Okay, very good. So what did you bring here this morning, and what do we need to keep in mind with our diet?
Right. So Erica, the big thing is there were some researchers from Harvard that looked at two groups of men. They looked at about 1,000 men, and they followed them over a 10-year period, and they looked at their diet. And what they found was those that had a healthy Mediterranean-like diet had about 1/3 less chance of dying from their cancer than those that ate a fatter Western diet that unfortunately we see a lot of in our society. So the important thing is the healthy types of foods that we want in the Mediterranean diet is we want things that are low in saturated fat. So for example, if you're trying to get protein in your diet, we want something like taking fish. They say that having fish 2 to 3 times a week because of the omega-3s, and also the vitamin E has a protective effect. The other things that are important to consider in your diet are taking nuts like almonds are great, walnuts are wonderful, and there's a grain called quinoa, which is a natural grain that's high in protein, and those are great sources for protein. The other important thing is staying away from the polysaturated fats. The vegetable oils are not as good as like an extra virgin olive oil, again thought to have a protective effect. Beans, again, very helpful because of very high in protein. Eggs, the same thing, high in protein. Also, they contain an element called choline that blocks absorption of fat into the liver. Superfoods, obviously, I always tell patients, any kind of green or leafy vegetables, great. Broccoli is wonderful, spinach, asparagus, and then any of these super fruits like the berries. The blueberries are great, raspberries, strawberries. These are all part of that Mediterranean diet. Now, the interesting thing about this study was that they looked at patients over 10 years, and I had said that if they had a fatty Western diet, they had a 2.5 times increased chance of dying from the cancer. And unfortunately, what the study didn't do, though, is look at those people, how they ate before they actually had it.
What are we doing with the wine?
So the wine is also thought to have a protective effect for the cardiac disease, also for Alzheimer's, and probably has a protective effect, just part of that Mediterranean diet.
Again, probably just the 1 or 2 glasses,
yes,
right?
In moderation, exactly.
Not the whole thing.
No, not the whole thing, right.
Very good. Dr. Chaffoo, this is really important information for our loved ones to keep in mind, and also get checked, obviously, every single year, going to your doctor, because you said the symptoms, there really aren't that many symptoms.
There are no symptoms whatsoever. So going to see your doctor, they'll do an examination, and then there's a test called a PSA, prostate-specific antigen. It's a blood test that's very often used, but your doctor will determine when you need that, and it'll tell if the elevated PSA, then there may be a problem going on with your prostate.
Very good. Important information. Thank you. To contact Dr. Chaffoo, we've put the information on our website, fox5sandiego.com. Just click on that CNA tab. Paul, I asked Dr. Chaffoo if he was going to open the wine bottle with a lighter like the beer guy did earlier. He said he doesn't have a lighter, so he can't. Otherwise, he totally
really?
would, I'm sure. Yeah.
Yeah, well, we're going to get that wine bottle open one way or the other, So we've got important news here. All right, thank you very much, Erica. New research.